Thank you very much. It's a great pleasure for me to present you the headlines of the Pacific trials on behalf of all the investigators. This is a double-blind, placebo-controlled phase 3 trial of durvalumab, a PD-L1 inhibitor in patients treated with chemoradiation for stage 3 unresectable non-small cell lung cancer. So, about 1/3 of the patients with lung cancer present what we call stage 3 disease, which is a local regional disease. So no metastatic disease, but it's not localized either. They typically do have some extension locally and regionally. Typical treatment over the last decades has been concomitant chemoradiation, and what you expect to get with this is a median PFS, progression-free survival of about 9 months, and about 15% of the patients are alive at 5 years. Considering that not major advances had occurred over the last 2 decades, I think there's an urgent clinical need to novel therapeutic approaches in this setting. Due to the performance of PD-L1 inhibitors in the metastatic setting, some investigators initiate trials in earlier disease stage, such as stage 3, and actually Pacific trial is the first randomized trial in this setting for stage 3 patients. Durvalumab actually is a monoclonal antibody against PD-L1, which is a protein that the tumor cells do express to actually interact with this receptor here, PD-1, which is on the immune cell, the T cell. By interacting with the PD-1 receptor, it provokes an inhibitory signal that actually suppresses the T cell and avoids T cell killing to the tumor. You actually inhibit this interaction with the monoclonal antibody, for example, durvalumab, you actually inhibit this suppressive signal, and therefore you enhance the immune system and you actually enhance T-cell tumor killing. This is the design of the study. Locally advanced stage 3 patients treated with chemoradiation. If they do not progress after chemoradiation and are in good shape, they had been randomized at the end of this period on a 2-to-1 fashion to durvalumab, standard doses, every 2 weeks for a year, versus placebo. Importantly, all patients were included in this trial, so we did not select for PD-L1 expression in the tumor. Main endpoints, PFS, and overall survival, and here we present the interim analysis for PFS. The trial is not mature for survival. And this is the main result here. This is the PFS curve, progression-free survival by an independent review committee, blinded. You see there is an increase on PFS on patients treated with durvalumab as compared to placebo. We have a hazard ratio of 0.52, statistically significant at 0.0001 level. What that means? That means that you decrease 48% the risk of progression all along the study periods. That implies an increase in median progression-free survival from 5.6 months on placebo-treated patients to 16.8 in durvalumab-treated patients, what I think is a very robust and clinically significant improvement for patients. Consistently, there is an increase in response rates, 16% to 20%, and of course, duration of response. Typical duration is less than 14 months with placebo and had not been yet reached the median to patients treated with durvalumab. Consistent with that, there is a decrease in the appearance of new metastatic lesions. That is true in everywhere, in lymph nodes, brain, or any visceral site. Consistent with prior data, the safety profile is pretty favorable, so there were no new signals in this setting. We found the toxicity that we previously knew on the metastatic disease setting. Some increase in the number of patients with grade 3/4 toxicity, but a small increase, 26% in placebo, 30% in durvalumab. Leading discontinuation, 15% of the patients with durva, 10% with placebo. You look at number of patients with immune side effects, which are, I would say, more specific for this type of drug, 24% versus 8%, but consider that only severe side effects, grade 3 to 4, 3.4% versus 2.6. So a very mild increase in frequency and severity, very mild toxicity profile. So overall summary, I think this is a clear improvement in the outcome, increase in PFS, about 11 months increase in PFS, consistent improvement in response rate and duration of response, and decrease in the number of metastatic disease. As we know, safety profile is quite favorable, and I think those improvements are seen in all patients in this trial. So overall, we think durvalumab is a promising option for patients with stage 3 non-small cell lung cancer treated with chemoradiation. And I think just acknowledge patients and families participating in this trial, and those are the investigators for many countries all over the world. And I would be very happy to take any question at the end of the trial, at the end of the session. Thank you.